Good morning, everyone. I'm going to present a case about neurofibromatosis and angle closure glaucoma in a child. So, 11-year-old boy, no case of neurofibromatosis 1, came with his parent to emergency department, was complaining of intermittent headache, blurry vision, photophobia, associated with nausea and vomiting, and that time he was vitally stable. Headache started at early morning, not relieved by sleeping or analgesic, no neurological or sinus symptoms, history of recurrence mainly at night. The patient is post-phaco for congenital cataract OU. So in examination, visual was 20/25 and the other eyes 20/30, and at that time, IOP was 17 and 18. Slit lamp examination, eyelid was within normal limit, no neurofibromas noticed OU, conjunctival there was only mild injection OU, clear cornea, anterior chamber there was only central deep and shallow peripherally, pupil was reactive to near and light, no iris hematoma or nodules were noted at that time. Lens, the basic IOL was in place, vitreous and fundus were within normal limit. Optic disc was normal size with cupping of 0.6. Goni examination shows oppositional angle closure. Cycle refraction patient was +1 only hyperop. Axial length, anterior chamber depth, corneal pachymetry, all were normal, as well as the visual field as shown here. Optic nerve hit OCT, there is only mild thinning, but it's not that much significant in the superior of the optic disc. UB-MB scan were normal, no obvious ciliary putty masses was detected. Anterior segment OCT showed only thick iris. So in systemic examination, there was only multiple cavernous spots, mainly in the thigh, forearm, and trunk. MRI was unremarkable with no evidence of intracranial or intraorbital lesions. Multiple trial done for YAG-PI for both eyes, but failed due to the thick iris. Then patient shifted to surgical PI, and specimen sent to histopathology, and it was normal iris tissue. And upon multiple follow-up, patient was stable, and no attacks had occurred to him. So neurofibromatosis is neurofibromatosis 1 is an autosomal dominant disease caused by mutation in the tumor suppressor gene, which results in increased cellular proliferation and leads to tumor formation. There are a number of ocular manifestations associated with neurofibromatosis 1, including iris, niche nodule, optic nerve glioma, neurofibromas of the eye, as well as orbit and choroidal nodules. A glaucoma in neurofibromatosis is not uncommon, and there are multiple mechanisms that can cause it. So one of them is the bi-infiltration of the neurofibroma into the anterior chamber angle, or neurofibroma of the ciliary body and choroidal causing thickening with subsequent anterior displacement of the ciliary process, resulting in secondary angle closure glaucoma, or anomalous angle, or neovascular angle as well. But in our patient, there was no evidence of ciliary body neurofibroma, and the iris was found to be normal in histopathological examination. The axial length was normal, and angle crowding secondary to thick iris is likely the mechanism. So oppositional angle closure glaucoma in a young age is extremely rare, and by reporting this case, we have to highlight the alternative glaucoma mechanism, which may be easily overlooked, but potentially leads to significant visual loss. So my question is, with such almost normal parameters, neurofibromatosis 1, how would you manage them in emergency? And is there any screening method for glaucoma in emergency? I mean, regardless of the presentation, any neurofibromatosis patient.
Thank you very much. That's very interesting. Can you just clarify why you made the diagnosis of angle closure glaucoma? Was it just on gonioscopy? Because on the anterior segment OCT you said didn't look like angle closure.
Yeah, there is angle closure, but it's a positional angle. The patient has intermittent attack, and there is also optic disc cupping. So we did as a prophylactic surgical PI, and after that the patient was stable.
Okay, so the patient was intermittently symptomatic, were they?
Yeah, he was symptomatic, but this is his symptoms. I have intermittent, like this.
Okay.
Thanks for that presentation. First of all, I'm confused why the diagnosis of neurofibromatosis was made.
Yeah, he genetically approved, and he has positive family history of neurofibromatosis. His father is neurofibromatosis 1, known case.
Second, I'm confused about the cataract. First of all, neurofibromatosis is not associated with neurofibromatosis type 2 is associated with the juvenile cataract, but neurofibromatosis type 1, you described this as a congenital cataract. And if it was really a congenital cataract, to have 20/30 vision is really surprising.
This is after the cataract division.
Yeah, but when was cataract surgery done?
Was when he was child, at age 4 years old.
So it's probably a juvenile cataract rather than congenital cataract. You know, this patient is behaving like a plateau iris. I don't know if it has anything to do with neurofibromatosis. It is possible to have plateau iris in children.
Yeah, this was my question, and that's
That has nothing to do with neurofibromatosis at all. Yeah. And I'm not I haven't seen evidence that this child has neurofibromatosis from the information that was in the presentation.
I mean, obviously, you had closed angles, so you did, if I understand it, a prophylactic peripheral surgical iridectomy, which I think was the proper thing to do.
Yeah.
And because this child had the risk of forming closed angle glaucoma if you didn't do that. So the management, in my opinion, is as correct as I think you did. So that's sort of...
Well, as far as you treated the patient, that's fine. The diagnosis, of course. All right. Okay. Thank you very much. Thanks.
Thank you.